Hi, I'm Dr. Nicole Heidemann. I am the chair of the Department of Obstetrics and Gynecology at TriStar Centennial Medical Center Women's Hospital in Nashville, Tennessee. Today we are here to talk about the most commonly asked questions that I get from our expectant moms regarding labor and delivery. I always wear a mask both in my office and at the hospital and when out in public, but for the purposes of this video, we will be taking it off. I think a lot of things have changed in our current time here at Centennial Medical Center Women's Hospital, but we're working to maintain as much of the same as possible. Right now, all of our classes are online and available. If you have any questions that were to be coming up after the class that's not answered online, then our birth educators are still available at all times at the hospital. I think the second thing that comes up is screening. When you present to the hospital at the time of labor and delivery, everybody will be screened, the patient, yourself, as well as your support person, and if you have a labor support person, they will be screened as well. During labor and delivery, you can have one support person as well as your labor support person, such as your doula. The doula will be asked to leave a couple hours after the immediate postpartum starts, but your support person can maintain that time frame with you throughout your stay. You may actually designate one additional person that could change out one time per shift if you have somebody else that needed to be there with you at any period of time. Also, most of our patients, our moms, are hoping to go home a day early just to return to their families and be a part of everything at home again. And I'd say most of our medical staff is in support of that if possible. I think the last thing that we see is I get a lot of questions about masking during your stay. If you're out in the hallways or if you're just in your room and we're coming in to visit you for a period of time, we ask that you do put your mask on, or your support person with you put your mask on. But when it comes time to deliver and you're in the middle of pushing, there's no need that you'll have to wear your mask if you're healthy. We'll dress up and put on all the appropriate PPE and keep ourselves safe so you can have a most natural experience as possible. Our goal is to provide just the safest care in this environment, but provide our most family-friendly care as well, so that you feel very comfortable that you are where you want to be when you have your baby. One of the luxuries at Centennial Women's Hospital is that we have a multi-floored unit, so we have the luxury of being able to separate our COVID positive patients from the rest of our laboring patients and postpartum patients. It's in the same hospital with our same labor and delivery nurses that are wonderful, our same amazing postpartum nurses, as well as your same physician. We will be masked and wearing appropriate gowning during the experience, but our goal is to maintain as normal and as family-friendly an experience as possible. We have the ability to use a negative pressure room. We have an isolated OR close by. We have a separate entrance for families and mothers coming in that are COVID positive. So from a COVID positive patient standpoint, you're getting excellent care just like you would if you were on our labor and delivery unit with our specialized staff as well as your physician. If you're COVID negative, you can feel completely safe because you've been separated from any of our positive patients, and then you have our same experience that we've always been able to offer. Our goal at Centennial Women's Hospital is to provide the best mother-baby centered care that we can. It's really a decision between the obstetrician, the pediatrician, and the mother to determine how well is she, how well is the baby. Of course, we want to be cautious, and we recommend having a screen between mom and baby when in the room, as well as making sure mom is masked, having washed her hands and done all the appropriate sanitation things prior to breastfeeding. But our goal is to be as family friendly as possible in a very safe environment. If you have any further questions that we haven't answered through this little short video, don't hesitate to reach out to your obstetrician or your midwife. They are easily available to you. If you have any questions specifically for the hospital, we have an amazing nurse navigator who is available and can answer all of your questions. And remember, we are a 24/7 unit, so we are always there if you need anything.